Pharmacy Guild of Australia is lobbying Labor MPs over a proposed change to dispensing. Under the change, patients on just one medication could save $180 a year. That is by only having to go to the pharmacy every 2 months instead of every month. Pharmacy Guild of Australia National President Trent Twomey says there's a concern, though, it could affect community pharmacies, forcing some to reduce hours and service. He joins me now for more on this. Thanks for your time. I guess just starting with, if this plays out without hurting pharmacies, just parking the concerns for a moment, can you see the benefit to consumers not having to go every single month but every 2 months for stuff they know they have to get and they don't have that inconvenience and the cost as well?
Every pharmacist, Tom, in Australia supports cheaper medicines. I mean, we're the ones having those difficult conversations with Australians about which medication they can go without, which family member gets priority over another family member, can they take half the dose? And the ABS has said there are over 900,000 Australians that are delaying, deferring or go without. So the Pharmacy Guild, all the pharmacy bodies, every pharmacist that I know of supports cheaper medicines. But you don't see the Commonwealth Government's cheaper childcare policy being funded by cuts to childcare centre. You don't see the government's free TAFE being funded by cuts to TAFE. But here we are with a policy that's been cooked up by the bureaucrats in Canberra with no consultation with frontline healthcare professionals that is cutting community pharmacies to fund cheaper medicine.
Okay, a few things to go through. You said no consultation. So what's happened? There was no consultation ahead of this change, was there? And have you spoken to the Health Minister Mark Butler since?
So, yes, I have had a brief conversation with Mark. Haven't had the opportunity to have a face-to-face meeting yet.
And what's a brief conversation? What do you
text message exchange, phone calls. So there are conversations, right? So the door's open. It's not like he's not talking to us and we're not talking to him. That's not the case at all.
Okay.
But unfortunately, and we saw this spill over into the Australian today, is that there is a big disconnect. There's a disconnect between what the Department of Health are briefing up into the government. There was a meeting yesterday afternoon with the Secretary, the Deputy Secretary, all of the leadership of the Department of Health that cocked up this policy and cooked up this policy. They're giving a completely different briefing to what the 80 frontline community pharmacies that have flown in from all around Australia. And this isn't just the Pharmacy Guild. We've had the Pharmaceutical Society. We've even had the pharmacy students. We've had the Australasian College of Pharmacy, the education body. They've all come in to meet with their local MP, with their local senator, to say what you're being told is wrong.
Okay, so that's the lobbying that's going on. Let's go through the issues you listed. You say it's a cut. So $1.2 billion is what will not be spent directly on this particular element. The government's listed where the money goes back in. Expansion of immunisation, $114 million, $377 million on opioid dependency, and double the funding for programs around regional remote pharmacies around a range of things, $734 million. So that's the $1.2 billion that's being put back, isn't it?
Yeah, so let's talk about that. The government's own economic analysis. So this was done by Prime Minister and Cabinet, by what's referred to as the Office of Impact Analysis. And this was done in response to the Department of Health's proposal. So I'm not going to talk about my figures, I'm going to talk about the government's own figures. They have said that this is going to cut $2.8 billion out of community pharmacy. Part of that are savings to taxpayers, which is the 1.2, and the rest of it is savings to consumers. Who doesn't love savings? I'm fully supportive of savings to consumers, but that is coming out of cuts to local community pharmacies.
Well, so what is the difference there? What's the 1.6? Is that because people are not going in there and buying moisturiser and...
It's got nothing to do with retail sales. It's all to do with the amount of money people pay for prescriptions. And I have been advocating on behalf of my patients, on behalf of my pharmacists, for cheaper medicines for 2 years. And we got that co-payment dropped really, really importantly from $42.50 down to $30 for things like insulin on the 1st of January, and that was welcomed.
Yeah.
But instead of the government going further and cutting that further, they decided instead of halving the price of medicines, let's just give people extra when they go. Now,
the saving listed in the budget is specifically $1.2 billion.
Yeah.
That's money the government is no longer having to hand out, and they say they're investing all of it. Where does the 2.6 come from?
The 2.6, so it's the difference between what the customer is paying, what the patient is paying at the pharmacy, and what the government is actually paying the pharmacy. And the difference is the saving to the patient. Isn't that a great thing? But as I said, we're not funding cheaper childcare.
So it's the profit the pharmacy makes off the patient?
It's not the profit, it's the wages, right? It's the wages we pay to open before you go to school in the morning. It's the wages we pay for pharmacists and pharmacy assistants to stay open on nights and on weekends where no one else is open. right? No GPs open after work and before school. No GPs open on a Sunday. So all of those people now are going to have to go to an emergency department because it's going to be the only thing open. And happy to talk about what they're referring to as this reinvestment, because, Tom, it's not a reinvestment. All that money does is pay for programs that are already there.
Well, but it's more money, and immunisation's uncapped, and I think you get more money
it's capped. It's capped. It equates to 5 vaccines per pharmacy per week. 5. So, it's completely
Well, the government says that's an uncapped program, the expansion of it, and you get more per immunisation, $19.
No, we don't get more per immunisation. It's $24 to get an immunisation now, so it's a $5 cut per immunisation. So it's a cut for immunisations. There's only 5 immunisations per pharmacy per week. That's not enough for us to vaccinate the Australians. Your listeners and your viewers will know when they go to get their flu shot, and millions of them have done it so far this year, when they go to get their vaccine for COVID, there's 5 people waiting at any given time. And the government's saying, oh no, we'll just pay for 5 a week. I mean, this is just furphy. They're shuffling deck chairs. There's no new funds. And they talked about the increased funding for regional, rural, remote Australia. I live in regional, rural, remote Australia. It's where I live. It's where my kids live. It's where my pharmacies are. There's a $158,000 cut, and they're reinvesting a rip-roaring $3,000 per pharmacy. That's not enough to save jobs. That's not enough to save trading hours on Sundays and on weekends and at night. So this is why this issue is not going away.
But that's assuming that we can trust the 2.6 versus the 1.2.
It's the government's own figures. These aren't my figures. This is in the Prime Minister and Cabinet's Office of Impact Analysis. So this is why there's a disconnect, Tom. So what the department's briefing into the parliamentarians and what local pharmacists and the Prime Minister and Cabinet's Office are briefing into the parliamentarians do not meet up. And so the reason there is conflict, the reason there is uncertainty, the reason there is anger is because one department in this government is not agreeing and talking to another department in this government.
All right. The other warning, just quickly, you've said it's about a shortage of medicine. The PBAC is in charge of Australia's medicine stocks. It actually recommended 90 days, so it must be pretty comfortable having enough for 60 days. It's even listed as on May 11th, 3 shortages, but they all have alternative brands.
Yeah, so again, the factual inaccuracies, right? So first of all, the Pharmaceutical Benefits Advisory Committee, PBAC, does not control medication supply. What it does is it controls what medicines are funded by somebody with a healthcare card or a concession card.
But it also advises what shortages there are.
No, it doesn't. This is the whole thing. The Therapeutic Goods Administration, the TGA, handles medication supply. The PBAC that gave the advice has no power, no authority and no skill set to give advice to government on medication shortages.
You don't think it's perhaps liaised with the TGA and you think it's just randomly plucked a 90-day figure?
Wouldn't you think? Wouldn't you think that 2 elements of the government...
But are you saying they haven't liaised with the TGA?
They have not liaised.
How do you know that?
Because we asked them that. We said, why is it that the TGA are telling local community pharmacies, please restrict the supply, Tom, of medications that are short so people don't run out. And then PBAC is coming out saying, please give extra. And so we're getting conflicting advice of, do you want us to restrict supply so we don't run out? Or do you want us to give extra so people save money? Those two things can't be the same at the same time.
May 11, the thing I saw listed were 3 shortages that had alternative brands. So is it about running out of that type of medication or the brand of medication?
Both. And what your listeners will tell you, what my patients tell me, is all this does is add to confusion. And I know with my patients...
But if you run out of your brand, that's not as dire, is it, as running out of your medication?
Well, first of all, the facts are incorrect. There's more than 3.
Okay.
Right? There are hundreds. And if you go to the TGA's own website today, there was an extra 48 added overnight in the last 24 hours of medications that are short. So all we're asking is the government talk to themselves before they even talk to us.
Got to leave now. Trent Twomey, thanks for your time.
Good on you, Tom. Thanks, mate.